Morning. So that's a hard act to follow, huh? I'm going to talk to you today about out-of-school time, and that means before, during, before school, after school, summer, camps, things like that, and both school-based and community-based, with a kind of an emphasis on more of the community-based. But I really am thankful for the opportunity to speak with you today, and especially because this is dedicated to Tony Yancey, who was a friend and a colleague. And when CANFIT started in '93, Tony was one of our first grantees in '94. So we go way back, and it's really nice to be here and to think about her here. And so I'm going to do a little bit of context about out-of-school time, and a little bit about CANFIT, and then what I see in the field, because I'm in the field a lot and see lots of things that are going on, and I want to share with you some of that, and then some policy recommendations. Oops. So, out-of-school time. About 80% of the time, youth are not formally in school. So I know that a lot of our work as professionals is focused on school because it's easier to get them in an institutional place. But for a lot of the time, youth are, in the neighborhoods, at community-based centers, at churches, summer activities, hanging out. So a lot of time is out-of-school time. And nationwide, more than 8 million youth are in out-of-school time programs. And as I said before, it's before and after school, but also things like juvenile justice system and alternative schools, the foster care system, things that we don't think about, but especially in thinking about a low-income youth and youth of color, unfortunately, a lot of these kids are out of the school system. And so if we want to increase our efforts in obesity prevention, we have to look at some of the non-usual places to reach these youth. And as Joe was saying earlier about the history of segregation in the U.S., I found this statistic kind of startling, but in California, which we tend to think of as the melting pot of the U.S., that it's one of the nation's 3 most segregated states for Latino students and 5 most segregated states for African American students. And I put that in just to bring your attention to the fact that, a lot of racial and ethnic youth are in segregated situations. And so we tend to think of it as this melting pot, but often it's not. And that, as Lori was saying about the use of the internet and digital, that 93% of youth use internet, social networks are 55%, and 57% post their own content. So CANFIT. As I said, we started in '93, and our mission is to work with communities and policymakers to develop a culturally resonant policies and practices that improve food and physical activity environments for adolescents in low-income communities and communities of color. So we focus on 10 and up. And kind of one of our frameworks is this thought that culture determines values, and values shape behavior. And then from that behavior is the explicit language of culture. So a lot of our programs and trainings are culturally based. And we include youth culture as part of that. As I said, we do a lot of training, technical assistance, consultation to youth-serving organizations, developing materials. I have a few samples on the back table, and we do a lot of advocacy for policies at local, state, and national levels. Some of our current priorities are the implementation of snack, meal, and physical activity policies, using peer-led social media to market health, and looking at the quality of meals that are being implemented through child nutrition programs. We also promote the concept of health at every size, rather than obesity prevention or weight reduction. And we work on improving food systems and built environments in communities of color, and developing youth engagement strategies. A sample of that is we have a new project, Advocacy, where we work with youth to create YouTube videos and Twitter or tweets and Facebook entries about health activities in their own communities and to reach out to their peers to do that. In Oakland, we do an after-school learning community with staff from the after-school sites around a physical activity, trying to get them to think of themselves as community advocates for activity. We do a lot of workshops and trainings, we serve a lot of policy groups, and we provide technical assistance for several foundation initiatives. For the California Endowment, they're building healthy communities. For food and for the Kellogg Foundation, their food and fitness initiative, and for Kaiser, their heal zones. And a lot of the resources I'm going to mention are available on our website, and as I said, I have some in the back there and just a few little samples of pictures, because pictures are nice. One of the things we have is this 99 ways to promote health and after school, and it's an interactive guide that I have some samples of in the back. So what I'm seeing in the field, the good news. There's a lot of recognition now of the importance of healthy eating and activity in out-of-school type of settings. There's standards that have been created by the state of California, has both snack nutrition standards and physical activity guidelines that are specifically for after school. The National Institute of Out-of-School Time, NIOST, has a set of standards. The Y of the USA has standards. There's been an increase in after-school meals, which especially for low-income youth and youth of color is an important thing. And in California, last year, over 2.7 after-school meals were served as a part of the Hunger Free Kids Act. There's been a lot of joint use promotion, so we're seeing more community use of school grounds and fields. And thanks a lot to Active Living our research and others, there's been more research in out-of-school that's being conducted. As folks have mentioned yesterday, this use of technology, texting, gaming, digital badges, things like that, that are being done with youth out of school in Y settings, community settings to encourage youth to be active, to look at their communities and report to report on what they see through Facebook and Twitter and the web. There's also been an increase in nutrition ed and out-of-school time, community gardening, activity options, and there is attention paid to this whole idea of equity in out-of-school time. But there's a lot of room for improvement. This is a typical after-school meal since the Hunger the Hunger Free Kids Act passed, so a new out-of-school meal. Doritos, baked, but still Doritos, a bagel sandwich, white bread, cream cheese, a pineapple spear, a juice box, and milk box. Very monochromatic meal in a little baggie handed out to youth. So in the field, the things I'm seeing that are not so good, the implementation of a lot of the policies and things that we've been promoting as health professionals is very inconsistent. So dependent on the resources of the school or the program or the community, and so I think that this whole issue of racial equity, that in the more upper income school districts, upper income neighborhoods, you're seeing these stellar programs, and then when you go to some areas that I work in Oakland or in Southern Cal or in Boston or whatever, you see kind of things not being well implemented. Nutrition ed is often not correlated with access or with health. So you have a lot of enthusiastic people, often college students or just people who have a passion about eating, who are doing this work, and they're really well intended. and you see them doing things like teaching kids how to make pies, or talking about a smoothie to a group of youth who have no access to, a blender at their home, or things where it's just, there's kind of a disconnect between what the realities are for the youth that are in these programs and what they're being asked to do. Physical activity, especially in out-of-school time, is often endless variations of tag. It's like, I've never seen so many ways of playing tag, and it's like, because the staff are, often don't have a lot of training, so it's like the easy go-to. As I said, staff out training is an issue. In out-of-school time, it's a lot of turnover. A lot of, the wages are about $8 an hour. You see a lot of times where you can't get kids or get staff because of this $8 an hour, hour wage. I was talking to a program in a rural area where it's, it's 60 miles to get there and back. Staff make $8 an hour. It's a 3-hour program. They can't get staff to, do that. Also in urban areas where it's a kind of a rough population, youth with a lot of issues, they can't get staff at $8 an hour. And if they get the staff, the training of them is an issue because it has to be done regularly. The effects of sequestration on schools and communities has just begun, but I think we're going to see just enormous ripple effects of schools being closed, programs being cut. Even in Berkeley, the epitome of the farm to school movement, and school nutrition is cut, school gardens are being cut. This whole issue of school versus community-based after-school programs. Community-based after-school, church groups, neighborhood groups, boys and girls clubs, their funding is also being cut, and then you have schools are closing. So I think that just in general, the school programs tend to be a little more systemic, but because of the effects of budget cuts and everything, that's also suffering. And community-based programs are having to rely a lot on volunteers and donations, and I'll get to that in a minute. Also, the evaluation and monitoring of standards is lacking, and unless there's a foundation grant that a group has, it's pretty much not happening. There's an overemphasis on weight reduction. You see a lot of programs where youth are being kind of almost punitively, running laps and things that, because of this this fear of fat, rather than an emphasis on health. And then the food industry is, they're seeing that they're being shut out of schools, and so there's, the industry is going very heavily into the after-school setting. So there's a lot of donations to after-school programs, of curricula, of programming. You have groups like PepsiCo and Coca-Cola who donate millions of dollars to the Boys and Girls Clubs and other groups. So policy recommendations. Education about out-of-school, to educate the out-of-school time community about joint use agreements. Because although it's happening, I think that it would be good to have the community be advocates from the grassroots as well as it being a top-down issue. To include out-of-school, to include after-school and school wellness and farm-to-school policies. So often these things end at 3 o'clock. So to make sure that it's extended throughout the school day. To revise the child and adult care food program standards to be consistent with school lunch and competitive food standards. To establish programs that channel college students, especially female athletes, into community after-school programs as coaches and volunteers. So many youth are craving role models, and I think that would be a great opportunity to channel some of that work. And then finally, promoting a physical activity programming that provides a lifelong skills. As I said, tag, sports, those are the two things that you see a lot in after school. And it would be great to be able to do things that youth will be able to do their whole lives, not just in a limited time frame. And to support regular staff training and professional development in nutrition and physical activity, to extend the guidelines that we've been talking about to these alternative school and juvenile justice settings, and finally to emphasize youth engagement and health at every size in the work that we do. So once again, I thank you for the opportunity to speak, and would welcome your questions. Thank you.